Britta Orr, Chair of the Edina Community. Oh, thank you. I'm Britta Orr, Chair of the Edina Community Health Commission. We are going to bring the meeting of June 13th, I believe it is. Is that right? To order. So we'll go ahead around and have everyone who's in attendance please quickly introduce yourself. Start.
I'm Jessica Hong. I'm a senior at Edina High School. Well, I graduated, I guess, now.
My name is Nina Sokol. I'm going to be a senior at Edina High School.
What introduction do you want?
Just say your name.
Steve Sarles, Edina resident.
Caleb Schultz.
Christy Silka.
As I said, I'm Britta Orr, Chair.
Connie Weston. Kathy Kozad. Kristen Connor.
All right. We all know how to use the mics now. So with that, let's take a quick look at today's agenda. Could I get a motion to approve today's agenda?
So moved.
I second it.
All right. All those, if you've taken a look, no additions or changes. All those in favor?
Aye.
Any opposed? All right, so the agenda is approved, and we can revisit items later if needed. With that, please take a look at your meeting minutes for May 9th of 2016. Those should be in the agenda packet that was posted online. If we don't, do we have any changes or suggested edits to those minutes? Seeing none, can I have a motion to approve the minutes of May 9th?
So motioned.
Second.
All right, all those in favor?
Aye.
Any opposed? Terrific. Okay, this is the section of the meeting where we would take community comment. I'm looking around the room to see if we have any community members present. I don't see any today, just our invited guests on the agenda. So we have no community comment for today. Next on the agenda, reports and recommendations. I believe our first presentation will be from the Edina Resource Center. And is it Andrea with us today? So if you could step to the podium, Andrea, introduce yourself, and we're excited to hear from you.
Hello, everyone. I'm Andrea Bernhardt, and I work for Edina Community Education. And I'm here as my role with the Edina Resource Center. I also work with adult programs, youth programs, and our volunteer program. But today I'm here talking about the Edina Resource Center, which our tagline is, your connection to community information, resources, and services. So what is the Edina Resource Center, also known as ERC in our world? We are acronym lovers. So we are ERC. And the Edina Resource Center is a partnership between the City of Edina, Edina Public Schools, and the community of Edina. We are a free and confidential service to those that live, work, or go to school in Edina. We don't turn anyone away. If someone were to call, we don't, but that's really who we serve. We connect families and individuals to the resources based on their needs. There's really two parts to our services. We have the resource center where people call, walk in, email, and then we also have another portion. So I'll talk about each of those two portions in my presentation. This is how you can use the resource center. You can use it for yourself also, but you can refer a parent, family, coworker to us so we can help them. You can find a resource for a family or individual using our website of resources. If you go on there, we have a whole listing of resources based on categories. So if you're looking for a specific resource, that's a nice place to start. If you can't find what you're looking for, that's when you would call, email, or walk in and we can help you find those. We are a research and referral program. We don't provide any direct services, but rather connect individuals and families with various community organizations that actually do the service. When in doubt, just give us a call, send us an email with questions you may have. We are currently redesigning our website, so this is kind of a sneak peek of what it will look like. You can see there's, this is the home page, and we'll post different community bulletin board items. We do have a newsletter. If you're interested in joining, you can always sign up there. You can also email us, and we'll just put you on the newsletter. We do that every couple months. And then we have an About Us page, and then here's the resources page, which I was telling you about. We have just various resources listed there, and then people's services, the contact information where people can go. We're hoping that it's going to roll out in the fall, so keep an eye out for that. I talked about the resource categories, so we've summed them up into these various categories: childcare, community, crisis, disability, employment, health, chemical, mental, housing, immigrant, refugee, legal, senior, social services, and food, kind of those basic needs, and then transportation. So within there, there's a lot of different resources that you can get information for. I talked about how there's two parts to the Edina Resource Center. We have the call where people can come in, email us, and we'll get you the resources you need. There's also this component of kind of that community liaison. So we put our, I'll go to various committees, various meetings, the Edina Challenge, the Student Hunger Collaborative, which provides weekend food packs for students during the weekend who are on free and reduced lunch during the school day, and then they need resources during the weekend. So we help to collaborate all the schools to get on the same page with that and make sure that every student, all for all is our mission. So making sure all students have those resources. We have our Summer of Opportunity and Summer is Go Time programs, which are scholarship-based for students who can't, who have that financial need to participate in some summer programs. We have our Act on Alzheimer's Edina, which I have been a part of. I was actually at an all-day workshop today on that. And just so you know, Minnesota is one of the leaders in those efforts across the nation. So just so you know that. We also have our VEEP Back to School and Holiday Toy Drives, which we help organize with VEEP. We are the connection with our school social workers. So if they have a family coming in and they have a need, they'll contact us, and then we'll get information to the social workers. So they're kind of our go-to people when we have information to get out to students and families. The HUG program, which is helping us grow a lot of the that's through early childhood. We have our Thanksgiving baskets through Rotary, which we help organize families to get Thanksgiving baskets. The Regional Recovery Group, which is emergency preparedness, which you'll be hearing more about in a different way, but that's something we're a part of. And then also the Tri-City Partners, which is Bloomington, Richfield, and Edina. So that's kind of the role we play. We have, we're just out in the community and being that voice. We have the Edina Community Council, which is our decision-making body for the Edina Family Services Collaborative, and acts as the advisory council for the ERC. Our mission there is to be a catalyst for Edina community efforts to strengthen individuals and families. We're really made up of members from Hennepin County, Edina Public Schools, Bloomington Public Health, Community Action Partnership for Suburban Hennepin, which is CAPSH, and the city and the community, which Jeff is on our council. And then we meet bi-monthly, September, November, January, March, and May. We are in need of community members to serve on this council, so if you'd like more information, please contact me. And I'd be happy to get you more information on that if you know of anyone or you yourself are interested in joining that council. Here are the priorities and goals in our upcoming year for the council. We determined that the top 3 priorities or issues for our community in 2016 are alcohol, drug, tobacco use, mental health, and maternal child health. So the top 3 priorities or issues that our collaborative is going to be working on for 2016-17 is the development of a comprehensive behavioral health and wellness system capable of covering ages birth through 21. And then exploring application of the ACEs assets to the community at large, and then social emotional learning. So just to give you a snapshot of kind of the direction we're working towards. here is how to contact us. Like I said, you could call us, and we return the call within the day or the next day. Our email, website, like I said, we're redesigning it, but the current one is still active and ready to use. And then we are located at the Edina Community Center just up the road. And myself and Karen Rurick are the two staff that staff the Edina Resource Center. So that's a quick little snapshot of what the Edina Resource Center is. If you guys have any questions.
I've got a couple of questions.
Sure.
Okay, great. Actually, can you go back a slide or two? That one.
This one?
Yeah, I think I might ask about that in a minute. But so one question I had, you had, actually, you could go back even
Sure.
further if you want to on this, but the buckets of sort of referral resource categories,
Yeah.
right?
This one.
What type of interest is there in each of those areas, and what is the most commonly referred service or item for the city?
Recently, we've been getting a lot of housing requests, which, as you may not know, there isn't a lot of low-income housing in Edina, so we get a lot of questions about that. And social services, basic needs, we get a lot of questions on that. And this is just calling in or emailing. And another thing is we work with the social workers. We work with a lot of people to get information to them, so we don't know all of the requests that come in. But what we see in our office is probably those, and then a sprinkling of different things in all of them, I would say. But those are probably the two biggest. And we get a lot of senior requests for various needing food, needing transportation. Transportation is another huge one. So I would say transportation and housing are probably our two biggest needs that we're seeing right now.
I have a question about the Act on Alzheimer's, which I think is new project in the past 3 years. Were we a pilot program for that?
We were not one of the first, but we, I would say we're kind of in the middle to early adopters of the Act on Alzheimer's.
Are you able to just give a brief update of where that program is at? Because I feel like that started 3-4 years ago, if I'm correct.
Correct. And we had a grant which went through to various phases. So we had the community involvement phase, and we did community surveys. And then we moved it into action, and two of our main goals for that was awareness. So getting people to know what is a dementia-friendly community, what is Alzheimer's. So that was kind of one of the big pushes that we had, as well as caregiver supports was our second goal. So we worked with Normandale Healing and Wholeness a lot. And then our grant ended. So we're at the phase now where do we go now? We want to be able to sustain the work that we're doing. Where we're headed really is businesses, and having businesses be dementia friendly. So when someone comes in, they know how to respond. They know how to be dementia friendly. So people are comfortable coming into those businesses. So that's kind of our direction that we're headed. I would love any input that you guys have to bring back to the group. And we are meeting June 28th as our next meeting. So if you'd like to come, I'd welcome any new members to be a part of it. Or if you know anyone that's interested in those efforts, I'd love to have them be a part of it.
Thanks. I have a couple more questions.
Sure.
I was just curious in general, and I apologize if you said this, but what type of flow of people interacts with this center? You know, how many people in a year, how many people in a week? Are you tracking that sort of thing?
You know, it really comes and goes. One week we can have 5 calls a day, and another week we maybe have 1. So we get a lot of phone calls and emails, I would say, a fair variety of walk-ins. But the walk-ins are a little bit more, they need more than one resource a lot of times, so they're a little more time-consuming, just having, you know, maybe an hour, and then the phone calls and emails. It can be a quick question, like, I need a handyman, or it can be a more complicated question, and more needs are needed.
I assume you have a pretty clear relationship or a good working relationship with the City of Bloomington Public Health Department?
Yes, yeah,
Do
and
you
that's
refer
part
to
of,
them a lot?
yeah, that's part of what we do is connect with all of those different resources, try to hear what's happening, because, you can't know every single resource in every area, but we try our hardest to develop those relationships so that we can go to Bloomington Public Health and say, hey, we have a client that's looking for this, how can we best serve them? So we'll try to do the back end work for the clients so they don't have to call 5 different people to get the information.
That's very helpful, thank you.
And we do have a database where we track all of our
Okay.
calls, so we know. I mean, I could get you a report if you wanted more specifics.
I
I'd be
think I was
happy.
just curious about volume and sort of areas of interest.
Yep.
The areas of interest are intriguing to me. I think sort of in the grand scheme of things, we forget sometimes those in our community who are looking for basic answers about basic needs.
Yeah, and I can get you a report too and
Okay.
get it to Jeff, and he can send it out too.
The other question I had was related to the Edina Family Services Collaborative.
Yes.
I feel like I should know more about what that is. But you said that the group within there acts as the advisory group to the ERC, right? Or the
Yeah, it's
steering
kind of a
team?
dual purpose
Okay.
group.
Can you just tell
Sure.
us a little bit more about the relationship there?
Hennepin County has 11 different family services collaboratives, so we are one of them, the Edina Family Services Collaborative. And really, it's all about LCTS funds. I'm not sure if you're familiar with LCTS, Local Collaborative Time Study Dollars. So we get the money, and then we, as a council, determine how that's spent, what our priorities are, where it's going. And each collaborative does that a little bit different. So we're unique in the way that we work a lot with our social workers for our funding.
Okay. And then the last thing, there was I think it was a couple slides for the one that I had asked you just to pause on previously,
Yes.
that one year. Could you just quickly, because ACEs is a term that's familiar to me, but I don't know if it's familiar to everyone. Could you talk a little bit about the collaborative priorities and specifically about ACEs?
Well, ACEs, I would say I'm not the expert
Okay.
in explaining this. I would say Jeff Jorgensen from our student support services would be the best person, and I would highly recommend having him come talk to you guys about ACEs.
Okay.
And we determined these as a council, so we got together and looked at what needs are you guys seeing? We're looking at the community report through Bloomington Public Health. Where are our needs in our community, and then what can we do to focus on those? So that's kind of where that focus is. And I would say a lot of those top priorities are through our student support services with Jeff Jorgensen. But I'm drawing a blank at what ACE is. Can you remind me what it's?
I believe it's adverse childhood events. Is that
Yeah,
right?
effects, I think.
Experiences.
There we go. We're lucky
Um,
to get an E
So
word.
there may be others on the table too who know more than I do. I just, sometimes when you run into an acronym, you want to make sure everybody knows.
Yeah, it's basically things that happen to you in your childhood will affect you in the future, and you can't prevent that from affecting you in the future. Am I pretty on? Yes. So there's a lot of research being done. It started way back, so now they're actually able to see the results. So there's a lot more being done on a state and county level on what to do with this information now. How can we use the information gathered from that ACEs study to get those protective factors in play in our community so it doesn't have the effect that it could eventually have if no protective factors are in play.
Just a word to the
Thanks.
board. Have we not spoke of having Jeff Jorgensen or some interaction with him for as long as he has been in his position? Do you recall this, that they hired him and we've sort of thought, hey, we should reach out? We've talked about that, have we not?
I think we have, go ahead, Jeff, if you have anything to add.
He and the superintendent came to a meeting, is it last summer or the one before? Last summer. But we had low attendance at the meeting. But they came and talked before the rollout of mental health and wellness program that they're rolling out now, so.
I know Allison, I believe Allison Pitts has been in contact with him, and I'm pretty sure I missed that meeting myself when I was on maternity leave, but it's a good connection for us to have, so we'll just make sure that we invite him back maybe for an update at some point soon. Any other questions for Andrea? All right, well, thanks for being with us. We appreciate the update.
Thank you for allowing me to come speak with you about
Yeah,
this. If
absolutely.
you have any other questions,
I did
please.
have one
Yeah.
other. And I think you'd mentioned you're redesigning the website.
Yes.
As a consumer of, the Child Family Center and going to that website, I don't think the website was that distinguished to differentiate what ECFE is versus ERC. The acronyms get a little bit busy. And I would think if you were looking for those services, it could be a little confusing. And I thought that 6 years ago, like ERC, is that another arm of, so it's a little confusing even in that building as to who does what, just from the consumer end of things.
Yeah, thank you for that feedback. I'll bring that back. And
Just when you look at that tab at the
I know.
top, you're like, well, ERC and CFE,
What is
and then there's
that?
community ed, and it's
I
like,
know, education, I tell you, has
Yeah.
acronyms.
oh, it's just my consumer feedback.
Thank you, I appreciate that.
All right, thanks again. Next on the agenda, we've got Nicholas, and you're going to have to tell me your last name because I'm not remembering it, but from the Bloomington Public Health Department to talk to us about emergency preparedness. Nicholas Kelly. Thanks for joining us, Nick.
Thank you for having me. Nicholas Kelly, I'm the Assistant Administrator for the City of Bloomington's Public Health Division, which provides the services for Edina and Richfield. So I'm here tonight to talk to you a little bit about emergency preparedness and the work we've been doing in our emergency preparedness contract with the City of Edina. So I could talk for a long time about why we do emergency preparedness, the moral, the ethical, it's the right thing to do. In this case, it comes down to who pays us. There's a statutory responsibility. One of the requirements as a community health board from the state of Minnesota is that we prepare and respond to emergencies as a community health board, which is the City Council of Edina. So we have a statutory responsibility to make sure that Edina residents are taken care of and responded to in an emergency. Most of the time we think about that, that's police, fire, EMS. We're talking about public health emergencies, which don't always make the most common sense. So a tornado is not a public health emergency. A tornado that causes mental anguish, displacement, disrupts life can become a public health emergency. So the tornado that hit North Minneapolis a few years ago was not a public health emergency. The aftermath became a public health emergency with displacement, with residents being uprooted, disrupting daily life. Had a mental health component to that required interventions from a public health side. On the federal side, there's basically two primary reasons a public health emergency would be declared. One was declared for the Ebola outbreak occurring in West Africa. It's either a disease or disorder that presents a public health emergency, which is fairly vague, or a public health emergency including significant outbreaks of infectious disease or bioterrorism attacks otherwise exist. So essentially, public health emergencies could be thought of in the federal side as large infectious disease or, for instance, like lead in the water in Michigan is a public health emergency. So large, broad things that impact the public's health are public health emergencies. Getting back to city side, so Minnesota, the county of Hennepin, and the city of Edina could all declare public health emergencies independent of each other. Normally that would not happen. They're unlikely to be a public health emergency in Edina that didn't impact Hennepin County or the state. And we would just fall under the guidance of the state or the county declaration. And so how do we prepare? The CDC provides funding that we get from the state as part of our responsibility as a community health board. And that's provided through the Public Health Emergency Preparedness Cooperative Agreement the state has with the CDC. We're entering the 5th year of that budget period, and so MDH contracts with every community health board in the state to provide funding. And this shows you a little bit of what the funding looks like for this year. FEP is that Public Health Emergency Preparedness Cooperative. CRI is the City Readiness Initiative, the work that we do to prepare for bioterrorism in our community. So if a bad situation happened and all of a sudden tomorrow we had to provide antibiotics to the entire community or a vaccine to the entire community, that funding helps make sure that we have the capability and are prepared for doing that in an event of catastrophic proportions. Those are typically the doomsday scenarios that you think about for preparing. The difference there is a reduction we received for funding cut due to ZITCA debates in Congress. So City of Edina got a little over $3,000 less funding this year through MDH from the federal government because of that. When we get that funding, we basically have to do all of our work against core capabilities. So there's national standards for public health preparedness. This is our planning guide. It has 15 different capabilities, everything from mass dispensing to community engagement to general preparedness writing, report documentation. 15 different core capabilities. It's about 152 pages of detailed standards, measures, how do you know you're meeting them. What the state does is through that 5-year contract, where we're in the 5th year, they assign us different tasks every year so that we're getting a wide breadth of those capabilities covered or moved to the next level of our ability to meet those coverages. So this is an example of what some of the state mandated duties in the grant that Edina would get that we would provide for Edina. And so you could see, like number 2 is integrate access and functional needs of at-risk individuals in plans and exercises in conjunction with key partners. So updating the size, geographic distribution, and other needs of at-risk individuals is maintained by some agency in the jurisdiction. So we do that. We provide the maps, the details, so that we know if something happened in this part of our community, what populations are most at risk, which populations need the most support on our end to make sure that they recover just like everybody else. So that's one of the about 50 some odd duties that's provided for this current funding year, as an example of what that looks like. And so how this actually works is we work very closely with Edina. We have a fantastic partnership. We meet with Jeff every month. We also meet with Tom Schmidt and Daryl Todd, the emergency manager and the deputy emergency manager for the city of Edina, on a routine basis to make sure they're aware of what we're doing. They ask us to look at other things more specifically. We'll take a look at it and address those issues. And then we really tailor our work so that it meets the needs of Edina and addresses the concerns and challenges that are unique to Edina rather than having a blanket approach and one size fits all. So while our planning looks at capabilities for all 3 of our communities, we do interventions and outreach specifically to Edina to address some of the concerns that are raised by Jeff or Tom or Daryl to make sure that we're meeting the needs of Edina. And we work really closely with our partners in the metro. So we represent Edina, Bloomington, and Richfield when we work with Hennepin, when we work with the state, when we work with the other 7 counties in the metro on emergency preparedness work. So the priorities we're focusing on this next grant year are logistics for mass dispensing. If you can think through what the logistical challenge of taking enough antibiotics for the entire community and providing them to distribution sites within 48 hours of being told to go, from doing nothing to all of a sudden everybody in the community has antibiotics in 48 hours. There's some logistical challenges with that, and we identified some additional logistical challenges in our planning in our recent review of our plans we did with the CDC and the state. Updating our plans and procedures. I'm new. I've been in this position about a year. We have a new EP coordinator. She's been in the position about 5 months. Trying to update some of our plans and procedures to reflect a little bit more of operational realities of how we would actually see things actually occurring and be more function-based. Improving our HAN capabilities. The HAN is the Health Alert Network. It's the ability for us to reach out to all of our healthcare partners. So Southdale, the hospital, they get a HAN alert from us, they got to respond to it very quickly. And so we have all of our clinic partners, our veterinarians, our pharmacies in our 3 cities, part of our Health Alert Network. We can communicate to them very quickly. Want to work on improving that, make sure we get our response rates for people responding to us more closer to 100%. It's not there right now. And then strengthening community partnerships and improving resiliency. That's something we can always work on, and that's one of those things that you're never going to be done with. And so working with our partners in Edina to improve resiliency, and then adding new closed pod partners. Closed pod partners are our partners where we partner with a business or a faith community or community entity to say, hey, you know, we have 3,000 people we're responsible for. Give us antibiotics, we'll take care of them. And so then they don't have to come to a public pod, and it removes some of the burden on our end to make sure that we can take care of our most vulnerable populations. And with that, I'd love to answer any questions.
I have a question. What kind of drills do you have planned for the mass dispensing to practice?
So the primary exercise we're going to be doing this year is a logistics-based one. And so standing up our logistics unit and actually simulating getting antibiotics from the CDC and then breaking them down, and so we would be able to distribute them to our different sites and practicing that. We do routine notifications and communications drills. We do quarterly communications drills at our different sites, checking 5 different methods of communication to make sure we have a way to make it work if one of those 5 doesn't work. That's everything from radio to cell. Even we used to do faxes, but we don't test that anymore.
So you mentioned that it's tailor-made for Edina. What's the tailor making? Like, what are the differences?
So, like, one of the differences would be, like, in Bloomington, we have, like, a large CERT program. Edina doesn't do a CERT program. And so that means we would not, some of the responses we would do in Edina wouldn't be as much based on volunteers. It would be, we'd have to do a little bit of additional planning to make sure that we had the staffing there, because if we did something specifically in Edina, our volunteers in Bloomington could potentially be used, but we would probably do more staff. It also does different kind of interventions, like when we work with some of our communities in Edina that are a little bit more vulnerable, really partnering with our public health nurses that are out in the community. And we were actually just recently at one of our communities in Edina where we have a monthly nurse visit, doing community CPR, doing some basic emergency preparedness kits to recent immigrant families, and kind of talking about some of the challenges of preparing for emergencies in that environment.
Other questions? I have one question related to resiliency. I think that's a really interesting topic. What activities or efforts are happening specific to enhancing resiliency, and what does that really mean? Can you talk a little more about that?
Yeah, so working in public health, I look at what we do as either everything supports emergency preparedness or emergency preparedness supports everything else we do. And so everything we do in public health, I think, impacts resiliency. So all of our family home visiting, where we're working with young moms and making sure that they're prepared to take care of their kids and get them a healthy start, makes those kids resilient. Because they're not suffering from some of the challenges or the ACEs or stressful environments that could make them more vulnerable to harm in the future. And so the more we do those things, the more resilient our community becomes from a health standpoint. Then additionally, we're also working closely with Jeff and some of the planners in Edina on comprehensive planning. What health components can we bring to the bear on that to make sure that we're thinking about big picture, 30, 40 years down the road, where a community is going to be? And so the more structural things that way, the healthier our residents become on an individual basis, the more resilient as a whole the community becomes. And so we're not doing anything specifically on a resilience fair. It's just more recognizing that all the different components of public health that we work on as a whole make our community more resilient when we're doing it.
Thanks. Any other questions around the table? One thing that I was remiss in not raising with our last guest, and we should probably connect with her offline, but is there any way in which, there's an issue or way in which this commission could support the work that you're doing, or things that you want raised, either to us or through us to the council or anything like that?
I think one of the challenges is like we had a reduction in funding, and we talked a lot with Jeff about what that would actually look like. $3,000 is $3,000. That's not going to result in people being laid off, but that's essentially going to result in us not being able to do over the 3 cities, it's about $9,000. We're not going to be able to do some of the detail of some of the exercises we plan, so we're going to back them off a little bit. It's more something for you to be aware of, that, most of the emergency preparedness we do is totally based on federal funding. Our coordinator is entirely based on federal funding, and that's how it is for the majority of the country. It's how it is at the state level too. The majority of the work in preparedness is all federally based. And so if that becomes complicated in the future from a financial standpoint, it could erode a lot of the work that's already happened. So it's more of a keep it in the back of your minds. It's not imperiled right now, but if we keep having some of those challenges, we could be in a situation in the future where we don't have funding to do that kind of work.
You talked a little bit about the shift of money related to Zika. Was there any rationale as to why Zika is related to emergency preparedness? Are they anticipating emergency preparedness aspects to a Zika response, or is it just this is where we found the money because that's how it often works?
So the appropriations for FEP allow the CDC to have a little bit of discretion, and they asked for $1.9 billion from Congress. Congress hasn't figured out what they're going to do with that yet. Zika is mostly going to be impacting Texas and Florida, and so those states needed additional work. CDC's budget has no wiggle room, so they took $50 million from FEP, so impacting all 50 states, to really drive work that occurs mostly in 2 states. It was kind of a necessity on their end. They don't really have a lot of other options. So it may be restored if funding comes from Congress, but as it looks now, it's likely not going to happen.
Okay. All right, anything else for Nick? All right, well, thank you for being here. We appreciate it. All right, with that, we are cruising right along. I think one thing that I asked Jeff to do is that we could just touch base this evening on some of the topics that were raised at our last meeting around issues that we wanted to reflect on with the council when we had our work session in August. And I'm going to make you remind me of the date again, so if you can look it up, Jeff, while we're talking, that would be great.
I will look it up.
So just to quickly go through that and remind you all, we went through the work plan at the May meeting, and so I just wanted to call out those few things and make sure most of this was going to be connections offline, making sure that we were all prepared to speak to the council on these issues, but just to quickly run through them and make sure that folks are thinking about them. So one was related to getting an update again, if there is one, on the student wellness and chemical health work and sort of the new positioning or the new efforts around mental health resources and the RFP that was put out there. So Allison Pence agreed to work with me and make sure that we can provide an update to the council on that. I had talked to Nina about you maybe giving us an update on some of the work that students were doing and that You're Not Alone Club and some of that sort of thing. I think the council might be interested in hearing about that. I know we got a good discussion going on that earlier in the year. I was going to briefly just touch on the SHAPE survey and sort of the status of that issue, so it's something that they're aware of. We wanted to ask the council for an update related to the comp plan, which Nick just raised. I think it's an important one for us to keep our eye on in terms of where the different health levers are related to comprehensive planning in the city. We additionally talked about just recapping that the medical cannabis moratorium had lapsed. And then Caleb, you were going to maybe provide just some background information on what's going on across the country with sugar sweetened beverage taxes, and sort of prime the council on that topic. So those were the things that I recall from our last meeting as it relates to connecting with the city council in August. Any additional items that folks have been thinking about that we feel should go in front of them, and or anything from that list that for some reason has changed? Otherwise, I'm very...
Yeah, I was going to see about a tobacco 21 ordinance for the city of Edina, and we didn't get a chance to talk about that last time. I'm also happy to address any additional questions regarding the sugar sweetened beverage excise tax initiative. So I don't know if anybody's really interested in adding additional thing to the plate with our meeting in August regarding tobacco 21. So I guess I'd like to hear from people before I talk about it more, if there's not really any interest. But I'm also a little bit concerned with the amount of stuff that's on that list. And so I think we need to be really tight with our time, keep ourselves tight with the time, because there are things, and I think the sugar sweetened beverage excise tax, which would probably be brand new as a topic of consideration, will probably require a fair amount of time for discussion, Q&A. Whereas some of these other things may be report outs that, as long as we are succinct, then it will be a succinct item.
Yeah, I think a couple of those are pretty quick update items. I would agree with you there. So, and since we are just ourselves, I would consider both, and I had put tobacco at 21 on there, so I apologize for forgetting that. I think since we are sort of in an exploratory phase ourselves, it's really to raise and get kind of a reaction from the council, just sort of a gut reaction of where it's at, and do a little bit of education. So I would anticipate, I would agree, it's a fair amount of time. Is it a typical meeting length, Jeff, or is it just an hour? Or
I think we get about 45 minutes.
45 minutes, okay.
So you're right. It's
So we may
pretty,
need to pare it back even more. Allison may
just
or may
think-
not have the mental health and wellness update, because that depends on where it's at. So,
I mean, are any of these co-meetings written updates? So simply saying, again, for the sake of time, we provided you, council members, with this written update on this part of the plan. Please read it. Because we want to move on to other things that we know
Sure.
might require more discussion or time, given, the time limitation.
I would-
45 minutes, we're just starting our meeting 45 minutes into it.
Right.
We've
I
had
don't
two
know that-
presenters and,
I don't think we've done that before, but I don't see a reason why we couldn't. I can check to see what kind of form they would like that in. If it's just a memo or some kind of advisory communication. I can see if that's an option, and then we could focus on just a couple topics in the interest of time. They're always, I think the city clerk, who kind of advises people on meeting things, they're always willing to shorten things up in the interest of time. So I'll check on that, and I would think that that's an option.
thanks. So I didn't know it was 45 minutes we were working with. That's helpful.
Yeah.
That's a helpful point of information. So are there things on that list I just ticked off that lend themselves well to a written update? I'm thinking the update on the school mental health contract might be a good written update if they're not already aware of it. It would help. I'm assuming they might know something about it. I would think, it might be nice to hear from a student, so I would like to keep Nina
So
have
they
some
can actually
time to
speak
do
to
an
them?
update if you're
do
willing. I
that.
think that would be great. So I would anticipate having that not be written. Hearing from the council on the comp plan, I think is more of a discussion item, but could be relatively succinct. And I would like to do that. I don't think we need to revisit cannabis or shape. So I think really it would maybe be hearing from Nina and then talking about a couple of these sort of newer items from you, Caleb, and hearing from them on the comp plan would be our main issues, and we could do a written update on the school. Mental health. Okay. They might. And they did change the definitions and other things, so yeah. Okay, so does that sound good as a game plan? And I would suggest then that we aren't adding anything, but just making sure that we're ready on those issues. All right, perfect. Thanks. I wanted to just make sure that we kind of had that in hand before August is here, which it will be very soon. And we meet in July then prior as well. Okay, perfect. So we can revisit again. That was our last main item under reports and recommendations.
I have one thing
Do you have an additional?
request.
Yep.
So like Nick said, the contract will be coming up for the city's contract with Bloomington for emergency preparedness. So the council always asks, did the commission recommend signing this contract? So I would request a motion to endorse the council signing or renewing the contract with Bloomington for the next calendar year.
Do I have a motion that the city renew their contract with Bloomington around emergency preparedness for the following year? I guess 2017.
I motion.
And a second?
I'll second.
All right, all those in favor?
Aye.
Any opposed? There you are, sir. All right. Any other additional topics? Otherwise, correspondence and petitions, I don't believe we have any. Chair and member comments. I, at this time, open it up to any additional items that folks have been either thinking about, hearing about. I do my usual Sun Current review for health items. You know, now that I'm chair, I'm reading the paper more closely. I want to say there was a recent article on distracted driving. It's sitting on my desk right now at home. I don't know if anyone happened to read that, but look back at your most recent Sun Current if you didn't, but I'll bring it next time. It was, I think, a student weighing in on the issue of distracted driving. I may have invented that, but I'm pretty sure that's in the Sun Current. Any other issues, community items, things that have come up? All right, and then Jeff, staff comments.
So the work session is on August 16th. That is a Tuesday. So it would be the Tuesday before or the Tuesday after the commission meeting. So I don't know if you want to still have the August commission meeting and then have the work session meeting the next week. That's totally up to you. But that's at 6:15, and then council has their 7 o'clock meeting, so it'll move pretty quick probably, so.
So we
And-
can't go over and hold up the council session, is that what you're saying?
You know, sometimes the council gets down here a little bit late, and I think they have, you know, good discussions at their work sessions, so if it's a good discussion, sometimes it takes a little bit extra.
I think we can do our best to be on time for sure. That'll be helpful. Any other things we need to know from staff? I think you and I talked briefly about this. We had spoken last time. There was some coverage in the media about, it was like an old Superfund site or some water quality issues in St. Louis Park related to a potential cancer cluster.
Yes.
And that was bordering the city of Edina, and we were kind of interested in maybe hearing more about that. Did you get a chance to talk to city staff?
I did. I talked to Brian Olson, the Public Works Director, and he gave me some talking points. I will send these out. It's basically the city's been aware and is monitoring and is making sure it's vinyl chloride, I believe, is the product that they test for. And it started in the early 2000s. It was detected in Sherwood Park, well number 7. And they shut down the well until a treatment facility could be constructed. So I'll send these out, and you can take a look at them. But the Public Works is very aware and is monitoring the situation.
I know there was some interest from this group at the last meeting in hearing a little bit more about that. Does that still exist for folks, or, I mean, is that, I think we assumed they were aware. I guess I assumed they were aware, but
Like you
I don't know
would-
if we want to be educated a little bit more on it or not.
Like
What do
you
folks
would
think?
like Brian Olson to appear?
Perhaps, what
Okay.
do people think? So if it's possible, I know I would be interested in hearing more about what the history has been there and how they've been approaching it and what the sort of medical side of things looks like.
Okay. I'll send these out and then you can review and I'll also talk to Brian and see if he could stop by in one
Great.
of our next meetings.
Thanks. Anything else?
Not for me.
Maybe we can evaluate pending agenda items at the July meeting. Does that sound good? Okay. So we will revisit, keep the August meeting on your calendar. If it's the week prior, I guess that would be what, the 8th? The Monday prior to that Tuesday? So keep August 8th on your calendar and we'll evaluate in July whether that meeting is needed, depending on what's on our plate. All right. Any additional items? Otherwise, with that, I would call us adjourned. And I think I need to push the button, right? Somebody else? Nope, nope, okay. All right. Unring the bell.
You did that with